Okay then, well, good morning everyone. An overwhelming response at 8:35 in the morning. Good morning everyone. I think that's the best we can hope for. Firstly, thank you very much for hastily wolfing down your breakfast this morning. I hope you're not suffering too much from indigestion as a consequence. These breakfast sessions, well, often after lunch, it's described as the graveyard shift. I don't quite know what we can say for the early morning beginnings that we're faced with today. But just to briefly introduce myself for those of you that weren't in my session yesterday, my name is Dan Walsh and I lead on diversity issues in Pakistan and indeed across our work in South Asia. I also have the pleasure of being part of the Research Evaluation and Monitoring Unit, or REMU as we like to call it, based in Pakistan, which is the first British Council research unit established in any of our overseas offices. And it was established really to look at the areas in which we work in terms of education, society, English and the arts, and to produce credible research that would actually further the discussions and the debates in those areas. As part of that, we produced this report, which I will share the findings with you in just a moment. And moving from the margins was the first such undertaking in Pakistan. There had been a body of literature produced looking at the medical dimension of disability in Pakistan and considering the needs for rehabilitative services and the implications for humanitarian aid and so forth. But no one as yet had actually examined this from a social perspective and adopted the social model of disability in the work. And given the British Council's core remit in terms of education and society, we actually adopted that as a model for this research. So in the course of this work, we were looking at the social, economic, and cultural implications for disability in Pakistan. What's more, we actually considered the role of education within this. And I think I'll emphasize the educational aspects of the research in the report. This is probably the best point to check. Can everybody hear me? I get nods from the back of the room. That's always a reassurance. Okay, excellent. So the research was a largely an exhaustive qualitative exercise, which we worked with our partners, the Economist Intelligence Unit, that produced much of the education research that you've seen for the Global Education Dialogues. And we did this through an extensive literature review, as well as then interviewing 70 key stakeholders across different aspects, not just within disabled persons organizations, the DPOs in Pakistan, as well as the international NGOs working in this sector, but also the likes of the Higher Education Commission, the Directorate General of Special Education, and some of the notionally mainstream educational institutions. And we did this to ascertain what the main barriers people in Pakistan faced if they had some form of disability, and to see how that would change depending on the disability. As I said, this is the first attempt to do this, and as a consequence of this work, we've had the chance really to extend this conversation to each of the provincial governments in Pakistan. So we've worked with the governments in Punjab, Sindh, and most recently KPK to share the findings of this report and to help inform their policy. Many of the problems that are faced, I would contend, are shared across this entire region. Indeed, many of the problems faced were echoed in the UK and are international in that regard. We benefited greatly from having Professor Michael Stein from Harvard Law School as one of the project advisors. And his experience is unparalleled in the world. He'd worked in about a dozen or so countries on framing the legislation for improving the rights of persons with disability. And he provided an outstanding contextual understanding for this work. And he maintained that Pakistan was no different in many regards to the other countries across this region. So, when we started this, I know this is a recurrent theme throughout this GED, we were hampered greatly by the lack of credible data. Starting with the fact that very few people in Pakistan actually know how many people live in Pakistan. Trying to undertake detailed quantitative analyses was difficult from the outset. You'll see that there's a quite marked discrepancy in the projections for the number of people with disability in Pakistan. And I include that deliberately. Officially, according to the last census of 1998, there are 2.49% of the population that have some form of recognized disability. Perhaps the most consensual finding we've found in the course of the research was that this is complete bunkum. And this was incredible for any understanding. The estimates then varied, going as high as 15% of the population. And in fact, it's the UN that argue that 15% of the world has some form of disability. Moreover, when you look at prevalence rates, you'll find that, firstly, there's a very strong correlation between poverty and disability. And secondly, then, when you're looking at endemic factors, such as conflict, such as disease, and so on, you'll find that prevalence rates are higher. So we were asserting with some confidence that the prevalence rate was far higher than 2.49%. But in the course of the research as well, it was adamant, and Peter will support me in this, that we didn't undertake this as a kind of a worthy exercise. We didn't do this to pat the British Council on its own back in some kind of reflected glory. We undertook this because we thought that there was a sound business case for mainstreaming. And this came through quite strongly in the course of the research. The economic case is profound. And it's estimated that up to about 6.3% of Pakistan's GDP is lost as an opportunity cost from the continued social exclusion of persons with disability. So there is enormous potential for greater mainstreaming in this regard. I'd just like to highlight really 4 of the main barriers that were prominent in the course of the research. Firstly was an attitudinal barrier. And there was a sort of a misplaced chivalry and charity sense when discussing persons with disability, particularly when talking with officials from the ministries and indeed from the mainstream educational institutions, that there's an overwhelming sense of pity afforded to persons with disability. When we spoke in turn to the disabled persons organizations, they were incandescent with frustration about how this attitudinal barrier was preventing any further attempt to actually mainstream disability. The continued sense that actually we should somehow feel sorry for persons with disability is something that will continue to frustrate and indeed hamper any attempts to increase economic participation and extend educational opportunities. It's not a question about feeling sorry for persons with disability, it's more a question of providing, and I move on to the second point, the actual access that's required. And the access barriers were seen in many regards. Some of them were basic physical barriers. In one of the interviews we conducted, we spoke with a very bright young man who was a wheelchair user. And his grades at secondary school were excellent, and he'd gained admittance to one of the most prestigious universities in Pakistan to study computer science. However, the registrar for that, when he contacted the university, said, well, actually, I'm a wheelchair user. How will this affect my studies? The registrar responded to say, well, your lessons will be on different floors, and I'm afraid we don't have a lift, and there's nothing else that we can do for you. So even before he managed to matriculate at university, he was already debarred from studying effectively. Those access barriers came through in a number of regards, even down to the inclusion on the national identity card, in which there is now a special provision to register yourself as a person with disability, which can help you with your welfare benefits. But actually, the means to get into the offices to register in that way has actually precluded a large number of people from doing so. The communication challenges are seen in many regards as well. This affects the media that are used for communications. It also represents some of the limitations in access to the assisted devices that are required for communication, whether that being hearing aids or software such as JAWS to help those that are visually impaired. And as a consequence of this, there is an ongoing problem with communication. Fourthly, though, it's a lack of robust legislation in this field. Pakistan is notable in being the first country in South Asia to legislate on the rights of persons with disability, and did so in a national ordinance in 1981. But since then, the legislation that is in place either hasn't been enforced effectively or is too weak to actually effectively cover the rights and issues that are faced. This is being addressed in some of the provinces, but given the federal nature of Pakistan, it's actually very difficult to take a national solution to this. Now, when we're looking at the attitudinal factors, we realize that there's some cultural implications. Repeatedly, we heard from persons with disability about the challenges faced with marriage. In many regards, people were saying that there's a pecking order for marriage depending on your disability, in which those with visual impairments would be considered the best marriage prospects, and then working through hearing impairments and onto physical disabilities. This is also then seen through the context of the continuing social taboo around disability. In one interview, the individual in question was talking about the fact that not only did they flatly refuse to accept that they had a disability publicly, but so too did their parents. This despite the fact that there's incontrovertible medical evidence that would suggest this, but they themselves were embarrassed by the situation. And then, perhaps most acutely of all, those attitudinal issues are prevalent when it comes to learning difficulties. And as a whole, there is yet to be an effective national solution for children with learning difficulties, let alone for adults. I'm going to try to emphasize some of the educational implications. I realize most of you here have a particular focus on higher education. In truth, many of the problems that are faced in this area exist before you get to higher education, and the barriers are repeated and reinforced throughout primary and secondary education. The first factor for education in Pakistan is that it remains heavily segregated, and there is a special education sector. We are not arguing in the course of this research that all education should be mainstreamed, and there is a pedagogical argument to suggest that some special education is needed. But what is seen is that there is an ineffective approach to mainstreaming within schools, and moreover, there is actually a lack of capacity in itself. UNESCO last year estimated that about 1.5 million children with disability in Pakistan go without schooling, and this is largely down to a capacity issue. The special schools are mostly located in urban areas in a country in which 70% of the population live in rural areas. So this, as I say, creates a problem long before you get to university entrance, and then the implications for appointments to faculty, let alone for higher education leadership, are all the more acute. So the Higher Education Commission do impose a quota for entrance into university, but what we saw in the course of the research that this isn't adhered to, and nor are there really any meaningful sanctions taken against this. So there are economic implications for this. For the more disadvantaged families, there's an argument put forward that actually investing in the child's education, given that they would have very poor employment prospects, may not be worthwhile. Given the frustrations in the educational opportunities, this is then manifest in the economy as a whole. And you see a lack of understanding in this area. We spoke with some of the leading blue chip companies in Pakistan, and very few of them would have had the equality or diversity policies that Patrick and others were discussing yesterday. So generally for the employment prospects for persons with disability, it would be the product of either a family connection or indeed would be through a dedicated corporate social responsibility program. Notwithstanding that, though, there are some excellent examples of how those CSR programs have developed. We work in partnership with one of the leading telecoms companies in Pakistan, Telenor, that have a dedicated recruitment program for persons with disabilities, and they maintain that this has been not just a worthwhile exercise, but one which has been entirely productive. So opportunities like that have broken this cycle of low-skilled, low-paid jobs with little prospect for advancement, and trying to move away from these kind of menial positions to things which have greater economic potential, both for the individual and for Pakistan as a whole. The costs, as we argue throughout the report, are significant. And this is actually an important means to attract the policymakers to encourage change. Obviously, in the context of Pakistan, talking about issues such as disability and indeed issues such as gender, you're always competing against a narrative that suggests there are more important things to contend with. We would argue that actually that mainstreaming persons with disability is an integral development goal and should be considered as such. And a number of the leading organizations in Pakistan echo that too. I mentioned before that there's rather weak legislation in this field. Just to share with you one of the more anecdotal elements of this regard, and that there is actually, once again, a quota imposed for employing persons with disability, particularly within public sector organizations. Once again, we found this was seldom adhered to. And then when we were asking the disabled person organisations, why do you think this is, they told us that the actual fine that's imposed is less than the cost of installing the ramp to support a wheelchair user. So at which point you realise some of the futility in this particular legislation. Pakistan, as indeed as every other country in this region, has signed the UN Convention for the Rights of Persons with Disability, which should enshrine many of these rights. Pakistan's ratified the UN CRPD, but we found little discernible evidence of how things have changed since then. Most of the focus of the legislation is on some form of physical disability or sensory impairment. And we found it difficult then to find evidence of learning difficulties, intellectual disabilities, or mental health issues. And then, in trying to ascertain the accountability for this, and it's not necessarily the case, and Michael Stein shared with us a number of examples of how this works in other countries. It's not necessarily a case that you need a dedicated minister working on this issue, but in Pakistan, it was delegated so widely that there was very little accountability because of there are so many ministries working on these issues. So, as I looked to Michelle for the time with a kind of nodding thing, questions might be very quick, I'm afraid, people. Okay, so the recommendations we put forward were kind of about fivefold. We argued that there needed to be more coherence in government with clearer accountability and budgetary responsibility. We recognise this is a challenge, given Pakistan's federal nature, but actually this is the only way that there can be effective coordination of policy and working with the international donors in Pakistan. Secondly, that the legal framework needs strengthening, and the UN CRPD provides the means to support this. Throughout the course of the research, actually, we highlighted a series of inefficiencies. There is considerable scope for Pakistan to economise through effective mainstreaming. Looking at this in an international context, what you see with mainstream is that the initial investment might be significant, but the subsequent returns on that are far more efficient. So the initial investment in rehabilitative services or assistive devices can help greatly. The need for an inclusive education is paramount, and this does take the form of primary, secondary, and tertiary education. Through this, though, we hope that there will be increased employment opportunities that provides the necessary skills and competences needed in the Pakistani job market. And lastly, it's incumbent, and one of the great difficulties for disability, I might add, is that you tend to have many voices making the same argument. In the case of Pakistan, there's a clear need for a single united voice to lobby for these rights. I'll look to Michelle to see whether we have time for one. Oh, we've got a thumbs up for questions. I'm afraid the questions may have to be quick, but are there any sort of questions or thoughts on this, perhaps in relation to your own countries? Oh, Peter.
One of the challenges I think that gets asked about work like this is, why is the British Council giving views on disability, giving views on diversity? Isn't this just a Western perspective? So it might be worth just articulating some of the challenges around that we faced.
Indeed, and we have encountered sort of the inquisitive eyebrow that's raised when we start talking about these issues. This is an area which the British Council is firmly committed to, but actually Peter's point goes beyond that. And it's actually, how is this received by others? It's not the role of the British Council to be an advocacy group necessarily in this regard, and instead we've adopted an approach where we just wanted to better inform the discourse on this. But instead working through local partners and strengthening their voice has been the main means to actually catalyse change in this regard. So we have very strong working relationships with a number of the disabled persons organisations and indeed with the educational ministries. And through this, we found that there is actually an appreciation for credible, robust research in this field, but that actually it's incumbent on other people to take that argument forward. Okay, perhaps one last question before we go into the main session. At this table here.
Thank you so much. I am Mehwish from Pakistan, working with the government of Punjab. Thank you so much for your presentation. It's quite helpful for me as well to go into the facts and figures. The only thing which I would like to highlight here is you mentioned the special education comes under the social welfare and women development ministries. But in Punjab, if I talk about, we have 3 separate ministries. One is for women development, special education, and third is for social welfare. And for your record correction, or maybe need some information about Punjab specifically, if I talk about. You are so right about the things and legislation process, but I would like to say that Pakistan has been going through, the tough times. The democratic process could not continue for so long. We have been facing the military coup and military governments, but now this is third tenure that is democratic government is working. So we are working on these things and these issues as well, and I hope we'll come out all of these issues. Thank you so much.
Thank you. It is worth noting that of the provinces in Pakistan, that the government of Punjab were the most advanced in this area, but by some measure. Their investment was more considerable than any of your counterparts. I'm not just saying this because you're in the room, I hasten to add. But actually, it demonstrated the importance of having an appropriate government response and a collaborative response between different institutions as well. There's still more to be done, I'm sure you'll be the first to admit that, but Punjab was an example that we used in the course of the report to show the other provinces what's feasible. Okay, I'm getting a nod from Michelle. So firstly, thank you very much, everyone, for taking a half hour out of your breakfast this morning. And if you have any further questions, please just catch me over the course of the day. Thanks.
Thanks, Dan, for that. And I think as far as the higher education perspective is concerned, we would really like to find out from you whether this research has an impact in your countries. We talked just about the pipeline. If we're excluding people from the pipeline anyway on the basis of gender, that exclusion is heightened when you start taking out people who've got disabilities simply through lack of access, lack of facilities, and lack of recognition of the talent which these people possess. So we would definitely require your feedback in terms of whether there's something we can do also to look upon this issue in your areas, in your sectors, in your countries. We're going to take a little bit of a short break because we're waiting for some of the panellists for the next session to come back. So we aim to start in 15 minutes' time. So we encourage you to go and finish the rest of your breakfast and also enjoy the coffee and tea outside, and we'll reconvene in 15 minutes. Thank you.